Beautiful. This is Simone Landrum's story. Simone Landrum is a New Orleans woman who on Mother's Day 2016 found out that she was pregnant. She was excited when she found out that the baby was a girl due to already having two sons. However, 3 months into her pregnancy, she realized that this time was very different from her first two pregnancies. She began to experience complications and excruciating pain during her pregnancy. Simone Landrum remembered telling her doctor about the pain, headaches, and cramps, but he told her to just take Tylenol. Eventually, Simone Landrum felt like her doctor was brushing off her concerns. About 8 months into her pregnancy, she was feeling even worse. Her doctor told her that her blood pressure was high and that she needed to rest. 2 days later, she visited the medical center again, bleeding at an alarming rate. There was nothing but silence, and her baby girl was pronounced dead. And she was also notified that her life was in danger. She underwent an emergency C-section and was told that she had lost the baby girl because she had an abruption due to her preeclampsia. Her story reflects the black maternal and infant mortality crisis, which according to CDC, black or African American mothers are 3 times more likely to die during pregnancy.
What is maternal mortality? The World Health Organization's definition is the annual number of female deaths from any cause related pregnancy or its management, excluding accidental or incidental causes during pregnancy and childbirth or within 42 days of termination, irrespective of the duration and site of the pregnancy. Overall, moms in America are more likely to die during or shortly after childbirth compared to mothers in other developed countries. As you can see, the graph on the right shows the United States has an upward trend. Minorities are most affected, especially black women, who are 3 to 4 times more likely to die. The small graph on the left illustrate that most recent data has a 30% difference, and this gap is 42.8% of black women were dying as opposed to 12.5% of white women. Other minorities that report elevated pregnancy related mortality are Native Americans, Native Alaskans, Asians, Pacific Islanders, and Hispanics.
Now that we have covered what exactly maternal mortality is, let's get into some statistics. Black women are 3 to 4 times more likely to experience maternal mortality and pregnancy complications rather than white women. WHO states that 295,000 women died since 2017, and 97% of these occurred in low resource settings. Almost half of severe mortality, morbidity events, and maternal deaths are preventable. At the bottom of the slide, you will see a table that clearly shows how women of color are more affected to this cause than white women. There are many factors that contribute into minority mothers and maternal mortality rates, like education, employment, environment, income, transportation, housing, etc. Actually, black mothers with a college education actually have more deaths than white women who don't, which is shown at the bottom left of the slide. Insurance and lower education levels, neighborhood and environment, income, etc., can also increase the rate of maternal mortality rates. Also, immigrant mothers and mothers with disability and an ethnic background are also prone to being mistreated and given poor quality care, which leads to postpartum deaths when it comes to maternal mortality and infant deaths as well.
I'm going to be talking about risk factors. High blood pressure is prevalent among African Americans, and along with other pre-existing conditions like obesity and diabetes, high blood pressure can make a pregnancy very dangerous. This can cause eclampsia, which is seizures caused by high blood pressure during pregnancy. Cardiovascular conditions also affect pregnancies, especially affecting black women, who most of their mortality is due to complications of heart conditions. Black women are also 3 times more likely to have fibroids, which can cause postpartum hemorrhaging. It's important to note that a lot of these pre-existing conditions are signs of weathering, which are health problems that minorities and especially black people face due to racism, generational trauma, and other external societal factors.
Hello, I will be doing the complications of maternal health of minority women. When it comes to maternal health of minority women, systemic racism and discrimination impact quality health care. Misjudging pain levels and inadequate prenatal care. Not offering the full spectrum of care, from family planning and preconception to postpartum and into the first year of the child's life. Not listening to African Americans or Black mothers and patients. The risk factors mentioned in the previous slide are conditions that are preventable, treatable, and manageable with proper health care. But when you add implicit bias, income inequality, poverty, and lack of access to quality health care, they can become life or death illnesses. How to act for yourself as a Black or African American woman. It is very important to know the signs and symptoms or complications during pregnancy and after giving birth.
On the right, you will see a picture of Henrietta Lacks. Her story is an excellent example of medical mistrust from a historical context. To put it briefly, Mrs. Lacks's cervical cancer cells were taken from her without her consent or knowledge and later used as one of the most important cell lines in medical research. Given this, as well as racial bias when treating minority patients, medical mistrust refers to patients not trusting their physicians. When there is no trust, they are less likely to get the care that they need. Health disparities are serious disadvantages that minority mothers face. For example, in LA County, women living in poverty are 4 times more likely to report fair or poor health status compared to wealthier women. This is just one example of the intersection between social determinants of health and the health disparities it creates. Social determinants of health stem from 5 major factors. These are economic stability, social and community context, neighborhood and environment, healthcare, as well as education. According to Dr. Cassandra White, medical mistrust can be mitigated through improving patient-provider relationships. Examples include involving the patient in the medical decision-making process and providing informed consent. Programs such as Merck for Mothers, Erase MM, and the Black Maternal Momnibus Act of 2021 are examples of ways communities and policy changes are occurring to address and prevent maternal mortality and improve the quality of minority maternal health care. As long as there are people in the healthcare industry who fight for healthcare equality, we can help prevent minority maternal mortality. Thank you.